My name is Chris. I'm one of the faculty at the University of Michigan. I came to Medic a few years ago because I'd been doing work for our institution for I guess it falls under the term analytics, but really what I was doing was I was like making graphs that let people sort of play with their data. It was sort of the term everyone uses now is dashboard, which is a term that I'd never heard before until COVID. And then like suddenly around COVID, like everyone had like, does anyone remember this from like 2020? Suddenly like every county, every small town in the entire country, in the entire world had like a little dashboard that was like, how many COVID cases are there? How many people have been vaccinated? How many people have done, or how many people have like, or what like the wastewater level of COVID was, or like all these crazy things where like you could explore the data, you could come up with your own ideas about the data, maybe in good ways, maybe in bad ways. And that's sort of how I came to this. And then so I joined Medic in like, I don't know, 22, maybe? Yeah, something like that. To sort of take some of the data, all the really good data that Medic was getting, and sort of wrap it together in ways that people who can't directly touch the data and like look at these giant spreadsheets to allow people who did not have access to that data to sort of explore the data and sort of come up with ideas about how their own individual sites were performing relative to other sites, but also how individual providers within sites were performing, and then to sort of glean new ideas from their data, in with the overall goal of sort of improving all the metrics we were measuring, improving care for patients. And so I put together a couple of versions of this sort of user's guide before. Um, at various stages over the last couple of years. And so the slides that you're going to see are actually from that user's guide, which is like many, many slides of like the different views that are available on our Tableau server. I'm not going to go through all of them here, but what I'd like to do today, like in the next, since we have a little bit of extra time, is to go through sort of the main view, which is sort of the clinical champions view, and then allow you to sort of log in, get to that demographics tab that the MShield team has introduced for us. Look at some of your own data. You don't have to like do anything with it right now, but just log in, click around the buttons, see what you can see if there's any problems. And then in the next session after, I guess, lunch, in the breakout sessions, we'll have sort of more of like an open office hours where I'll be able to circulate and talk to you about sort of very specific things, very technical things for your own data, just so that you can sort of get familiar with using the resources that we've made available for everyone in this room. And so if you have a laptop, feel free to get it out and log in to your Clinical Champions accounts. If you don't have one, that's fine. I have some screenshots and things that we'll just sort of talk through. I'm going to warn you right now. I wasn't planning on doing this, but we have a lot of extra time. And so I wasn't going to do this in the big session, but we have a lot of extra time with like 30, 40 people logging in at the same time. It could take a little bit of time. So what I want you to do is everyone just start logging in and then click on the Clinical Champions dashboard. There should be like instructions on all the tables about how to log in. Log in. It will take click on the first view, that summary tab. It will take about 1 minute to 90 seconds to load. There. Hmm. Yeah.
And step away from the light is maybe helpful.
Yeah.
Just a little bit as you start
Okay.
away.
Yeah. I can hold the big mic. I can just hold this one.
Okay.
It's fine. Be easier. I'm good. So I just put the instructions for logging in on the screen, just if you need them there too, but there should be a printout on every table. Does anyone have any ideas for the meeting on screen? Okay. Feel free to keep logging in. I am gonna just talk and sort of move a little bit slowly here at first, and then we'll sort of progress through a couple of these different views on this workforce dashboard until we get to the demographics, and we'll stop there and sort of talk about that as well. And then in the next session, some of you may have these slides or download this user's guide. In the next session, we'll sort of go through some of those other activities about how to set up recurring emails to yourself with data from the dashboards, and then also sort of pick through all the different elements within each of the views. And so if you haven't made it there yet, that's okay. I'm just gonna sort of talk about this clinical champions all measures dashboard. And so, and I promise you this will eventually end in the demographics view, which is sort of what the main point of the session. So this is going to be a workforce view. It has all the medic initiatives, all the data from it, all wrapped into one. I apologize, it takes a little bit of time to load. If those of you have been clinical champions or abstractors from years past, it loaded much faster before. And I think honestly the reason it's taken so a little bit longer to load for everyone is because we have so much more data than we used to. And that's thanks to everyone in this room. Like we just have accumulated years and years of data about what's happening in patients across all these initiatives that has created an enormous data set of millions and millions of ER visits across the state. But that gives us a really, really wonderful advantage compared to many other CQIs, compared to many other ways that people sort of are trying to do volume improvement, in that we can compare our own data from our own sites across the entire network. And so that is like it is helpful for those of us who do research, but it's also helpful for all of us who are seeing patients and trying to improve the care in each of our ADs to allow us to see how we're doing in very, very fine detail across an entire network of EDs, knowing that every ED is like, knowing that many EDs see a variety of patients that are maybe different from our own, and sort of having some of that context in there as well can help. All right, so this is your first page. And this is where I'm going to ask everyone to start, is this sort of summary tab. Everything on this particular dashboard is designed to look like a piece of paper so that you can print it out as a PDF or email it as a PDF and send it to people. And so that is sort of the point. And so on this first tab, you're going to see, this is sort of our workforce view that has everything about all the different initiatives, all contained into one. There's a rank, there's a trend over time, there's a scatter plot compared to the number of ER visits. There is some error bars on these box plots to see where you are, sort of what the variability is over the last few quarters, over the last few years of a particular metric. And so the first thing I want to do is just take everyone through navigating at the top. Each of the views on the Tableau server is going to have a bar across the top that lets you select dates, the metric of interest. If you are a clinical champion for multiple sites or have access to the data of multiple sites, there will be a drop down there that like allows you to pick the sites that you are interested in and want to look at the data for. And then as you hover, if you take your mouse and you hover over any element on any of these dashboards, some more data will pop up. Some information about that particular data element will pop up for you. And so I encourage you to do that. But the main point of sort of going through this first view is just to work the navigation at the top. You'll also see across the top, there's a bunch of tabs for different views. I'm going to buzz through those, and then in this session, and then end at the demographics view, and then we'll talk a little bit more in detail about that. All right, so again, each view has a navigation bar at the top. Click those buttons to sort of see the time frame, the initiative that you want to look at, and then if you have access to multiple sites, click on those multiple sites. The ways you set up the dates are based on the P4P year or the VBR year, or whatever dates you want. There's a button that says date type at the top. You can go ahead and just pick whatever dates you're interested in. Keeping in mind, if you select a lot of dates in there, it will take a little bit of a moment to load all the data. The way all of these views work is like it loads the data first, and then you can click around in them. And so that's why it takes a little bit of time to load the dashboard. And please feel free to interrupt me for questions if there are any. All right, and so again, top left corner, you're clicking through the different initiatives and the tabs to sort of get to what you want here. I cannot emphasize this enough, but many of the questions that you might have about a particular element will be like a hover tab. You just put your cursor over the thing that you're interested in, something will pop up, tell you a little bit about the data that makes up that particular element, tells you a little bit of something about sort of if it's like a metric target, it'll tell you about that, whether up or down is good, that sort of thing. And then there's a little I button in the corner that tells you a little bit about that view in general. And again, you're just hovering over these things and it will tell you, it'll give you a little bit more information. All right, so now I'm going to go through each of these individual tabs fairly quickly, just to give everyone some orientation of the tabs. And so a lot of folks, I've gotten emails about like these views in particular. These are sort of the site and provider rankings views. You should see your own site unblinded, like all the rest of the views on these dashboards. You'll see your own data unblinded, and then you will see the other sites de-identified. To be fair, and you can, if you play around with this enough, can probably figure out some of these other sites. Try not to do that. We're trying to keep everyone's data as confidential as possible, but if you play around with it, you can sort of figure out, like, at least, you know, you can at least try to compare to similar size sites using the available data. But it is blinded for the other sites that you don't have access to. There's one view for providers, and then there's one view for sites. The sites view looks very much like the one on the left. It's sort of a ranking of who's performing the best or not the best on a particular metric. The provider view, if you're a clinical champion, you should be able to unblind it if you want to, or highlight a specific provider. The rationale for that is, like, if you are doing an initiative at your own site where you're like, hey, I want some of my I either want to call out my best performers, or if you want to help other people encourage them to perform in a different way, better way potentially. You can unblind it if you want, or you can highlight specific providers, and so there's buttons there at the top. Play with them. Questions, we'll talk about it in the next session too, if you have some specific questions about that. And then if you ever want the specific number and not the percentage number of like what's going on with a particular provider or site, hover over it. There'll be specific numbers popping up. And always keep in mind that, like, it sort of depends on the metric. It depends on the dates that you've selected. All right. And so this is another view that was sort of requested early from a couple of sites. It's like, how do I identify outliers in a particular metric? Because some people see a lot of patients, some people don't see a lot of patients because they don't work that many shifts. And so this was one of the ways to do it. There are other ways that you can sort of figure out, you can use to sort of figure out what works at your own site. But this outlier view basically shows a scatter plot of like whatever your selected metric rate is. I think on this one it's pulmonary embolism. And then it shows sort of what's called a funnel plot, which is basically error bars that funnel out as people get more and more observations. And so if you don't have a lot of observations, you're sort of allowed more variation because you just don't have a lot of observations. And so that's what creates that funnel. And it's centered around whatever the target is for the metric that you've selected. Again, on the screen, there's pulmonary embolism. A lot of sites want to know, like, well, what are the now that I've I've identified some outliers. Like, can we highlight some specific cases or detail those cases out for folks so that we can talk to those providers and see like how we can improve in terms of the metric. And so what you can do on this case list view is you can actually select a provider, select a site to which you have access to, and then pull out all their cases. You can pull out the denominator cases, you can pull out the numerator cases, or both for whatever metric you select and whatever time frame you select. You can print it out, you can copy and paste out the patient data. The blackout bars are obviously patient data. You can also get a little bit more information by hovering on that little circle at the end on the right side of the screen. And that'll bring up some more specific information about that particular case. Their like encounter number, their MRN, the dates that they were there, the provider that saw them, that sort of thing. A lot of people want to know sort of how my site is doing or how my group of sites is doing over time, and maybe even before and after a specific intervention. And so we added this view a couple of years ago for groups that really wanted to know, like, hey, I did an intervention. I want to see how we were doing before and after, so that I can just sort of print out a slide for folks to sort of look and see how we changed in terms of our practice. And so this view is a little bit complex, and so I just want to spend a moment here just sort of explaining it. And so what you see at the top is two line graphs. The sites that you have selected are in orange. The sites, all the other sites in Medic, all aggregated as one, are available in blue. And then the graph is divided in the center by a date that you pick. And so let's just say you had an intervention, January 1st, 2024. You might pick a year before and a year after to as your sort of included dates. You can select all that at the top. And let's say your intervention here is steroid use. This is steroids within 60 minutes for pediatric patients presenting to your ER. The selected sites are in orange in the bottom, and then everyone else in Medic is in the blue. And then there's some specific numbers at the bottom. But you can see on the screen, you can see that, like, for the most part, at least in whatever dates I've selected here, people seem to be improving across the entire collaborative. Both the blue line is sort of the trend is heading up. The orange line, the trend is heading up. Before and after that sort of selected date in the center, there was no intervention there. I just picked a date. But you at your specific sites may actually have a date where you're like, we did a quality intervention here. I want to see what's happening before and afterwards. And so that's the purpose of this particular view. And then you can start to, as you sort of click through the buttons here, you can sort of split it out and whatever dates you want, and then start to look at the individual. I think you can look at the individual month numbers at the bottom too. All right. Another way you might want to look at these things is might want to look at sort of a year-over-year trend. And so that's what this view does. It has sort of a similar, line graph in the corner, but it also has the ability for you to select a year of interest and then look at the year-over-year trend from the year before. The idea for this is sort of like, I can get a quick bird's eye view of like how my site is performing year over year in terms of like either the numbers of cases or the rate of the metric that you're interested in. And sort of just have one quick printout of like, hey, we're doing better compared to last year. And that's sort of the idea for this. And we can certainly, again, like all these views, we can sort of talk in more detail in the next session. This is very complex, and I wanted to spend a moment on this too. This is the balancing measures view. We introduced the balancing measures a couple of years ago as a way to make the argument that as we do things like cut down on the number of chest X-rays, discharge more people with low-risk chest pain, that we are not increasing the rate of negative events. Like, for example, a low-risk chest pain patient discharged and then coming back with a heart attack, within the next 6 months or 3 months. I can't remember what our metric is actually. The 3 months or 6 months, I don't remember what the major adverse cardiac event rate is.
It's like 6 weeks.
It's or 6 weeks, something like that. but there's a balancing measure that we've come up with for almost every type of med quality initiative. For example, the chest X-ray one, we wanted to look at whether or not kids were coming back with pneumonia, or coming back and getting admitted, or coming back and getting admitted to the ICU with some sort of respiratory support. Right? Those are bad outcomes for someone you sent home without a chest X-ray. And so the way this view works is that you're going to pick the metric you want. You're going to pick the dates that you want, the sites that you want, always all the same at the top and sort of navigating this. And then there's another row of little circles right below it. You are going to click the balancing measure that you want, and those balancing measures change for the particular type of initiative or metric that you're looking at. And so again, say for low risk chest pain, you're going to have the ability to select whether or not they came back with a major adverse cardiac event, whether they came back with just chest pain again, that sort of thing. And then you're going to see those cases on the line graph below it. The line graph is very complex. So in the bolded big orange and blue lines, that's your rate of your balancing metric. In the background, in these faded lines, that's the rate of the primary metric. And so, for example, on the screen right here, it's very small, I apologize. This is chest pain, major adverse cardiac events within 30 days of that low risk chest pain discharge. In the faded lines in the back, in the small faded lines in the back, that's your rate of discharge for those patients. And then in the bolded lines in the front is your sort of rate of major adverse cardiac events. The balancing measure outcomes are really, really rare. And so you're going to see percentages that are like 0.1%. And that's why we've aggregated them over years, because otherwise you would have no events most of the time. But the point of this is to show that they're really, really rare. And in the corner where there's on the screen, it's sort of blacked out, is your case list of all the balancing measure events. And so if you or your providers have concerns that we sent home someone who met sort of all the low risk criteria, but then they came back with a heart attack in the next 30 days, you can see those cases in that list and go back and hand review those cases at your own site and sort of talk to those providers and sort of see what that case means to your specific ED. All right, and now we are finally at the demographics view. All the other views, they're available to you. Play with them, develop your own ideas for quality initiatives at your own site. We're happy to talk about them all the time. If there's something you see that you didn't see that you want to see, a button, a filter, that sort of thing, please come to us. We can add it. We've collected lots and lots of data. Much of it is not being used because we just haven't been asked to sort of add a view for it or add a little variable for it that maybe hasn't provided us too much context at the coordinating star level, but might provide you a lot of context as to that initiative at your own site. Let's see what we're doing. 11:30. All right. Demographics view. We just added this in the last few months as we started to collect more demographics data from all of you. And so, what can we do with this? Well, it sort of starts at what categories are available to sort of stratify our to categorize our outcomes by. Race is certainly available. Ethnicity is available, although it's actually blank right now because we've had a little trouble getting the ethnicity data from some sites, and so it's actually blanked out right now. It would be Hispanic or not Hispanic. Race is available in ways that are maybe different than you've seen in other sort of dashboards or other research. It is available in one of two ways. So as you navigate to that page, if you can get there, hopefully no one's having too much trouble getting there. You can pull down a category, and there's you can pull down that sort of grouping category at the top. I don't think you guys can see it on the screen. It says select demographics. On the screenshot, it's gender, but you can pick whatever you want there. When you pull that down, you're going to see options for primary language, and that would be English as the primary language, or non-English language preference would be the other category. We're othering that one a little bit, but there's way too many options in that one. You're going to see sort of a multi-race category where we sort of classified everyone into different race groups, and then you're going to see the individual race groups that people have self-identified, or at least that's sort of the idea that they've self-identified at the individual sites, and we're sort of reporting on that data. But you're going to see sort of people who either who say identify more than one category. You'll see that as a binary. So if I identified as Asian and African American, like I would have that would be a yes to both of those individual categories. And so we binarized out all of that. So in case you want to look at it in that way, in the combined category, that's actually the old combined category where you can only be slotted into one. That was the older data that we have. And so we've left it there for context, but it's maybe not the best practice. The other things that are in there are different age groups, language, sex, and so those are all in there for you to sort of slice and dice your metric outcome by whatever groups that you think are important at your site. And so just to walk through that a little bit in the top left-hand side of the screen, you're going to see two what are called donut plots. They're like sort of pie graphs with some overall counts in the center, and then the breakdown by whatever your selected demographic is for your site, and then the rest of MENIC. And so the top is always going to be sort of your sites or selected sites if it's more than one. And then the bottom will be the rest of MEDIC. Everyone that is not selected will be sort of aggregated together there. Same thing on those line graphs. The top is going to be your selected sites. The bottom is going to be your unselected sites all lumped together over time. And then the very bottom of the screen, there's the little dot plot there. Basically what that represents is within your own selected sites, the rate of the metric for whatever time frame you have selected. And so you can see, at least from this picture that's on the screen, I believe this looks like head injury. And so I was talking to the folks at DCS last night about this. Is actually, so if you look and just using sex as the example here, we always seem to perform better. In other words, more appropriate head CTs in women than we do for men. And maybe and so this is an example of like a trend that you could see in your own site. It's probably true at almost every site. We tend to think men are involved in some sort of boneheaded trauma more. We have that bias as we go into it, and so we probably are testing men more for head injury more than we are for women, and so we end up with a worse rate of appropriate head CTs in men. The reverse is true for PE, where we're starting off with some bias. That women are more likely to have a PE. And maybe that's true because of pregnancy and because of oral contraceptive use. We technically don't have that data, so that certainly could be a confounder there. That's not what's on the screen, by the way. But that is certainly a trend that I've noticed as I've sort of explored this data, is that the appropriateness of a head CT for men from a head trauma tends to be lower, and then the positivity rate for a CT for PE for women also tends to be lower, because we probably start off with that bias in terms of thinking that a woman is more likely to have a PE for whatever unsaid reasons go into that decision making. As you sort of navigate through this guide, there'll be some call outs for like different buttons you can push. Push the buttons, you can't break anything. If you need to reset, there's a little reset button at the top. And then I think I'll probably just end here, and the rest of it I'm going to say for our little sort of open office hours session. But since we had so much extra time, if anyone has any questions, it is only 11:37. Well. And so one of the things I would sort of encourage you to do is to sort of go through all the metrics that or go through the metrics that you think you have an idea for. Just click all the buttons. If you want to slice and dice it by demographic group, go ahead. We like that. I think what's on the screen now, I think this is PE. It's on the screen. It's like very small in here. I apologize. Yes, this is PE. And so that if you click on PE and age, you can see that our hit rate for PEs across both the entire network and probably at every individual site, it's always higher for older patients, right? Like you're getting 11, 12, 13% hit rate on PEs for older patients, and then it drops to like 5, 6, 7% in the youngest group of adults. And so, maybe that's somewhere where, and so for me, not as our service chief or medical director, it's hard for me to make these changes. But if I were running AD, I'd start to think about that in a way that, like, maybe we can increase our dimer use in these probably low risk younger patients. We can increase our application of the PERC rule, or even just talk about sort of like trying to reach some consensus about pretest probability for these patients. In other words, sort of trying to come up with a group guideline as to, like, who we're really going to pursue PE on, and test for. Other questions or anyone have any observations they want to bring up? And again, if anyone's having trouble with access, I'm happy to circulate after this and then in the next session to troubleshoot some of that stuff.